Let's speak to Sandesh Gulhane, who's the Scottish Conservative health spokesman. Thank you for joining us on the programme. So the First Minister then has set out a plan to speed up hospital discharges and announce some new funding for health and social care. What difference do you think that will make?
Good afternoon, Andrew. So, I have to say that this press conference did very much leave me thinking, what was the point of this? We needed to have a statement in Parliament where we have an opportunity to debate this. And quite frankly, it's quite clear that the First Minister doesn't trust Humza Yousaf because she's now having to take over. She's now doing the work and chairing the meetings and is moving Humza Yousaf aside. And I think it's time that she sacked him because she's lost trust in him. As far as your question is concerned, when it comes to what difference this will make, well, actually, where was this plan a year ago when Humza Yousaf said they were doing the planning? It's absolutely unbelievable to me that we didn't plan for an increase in respiratory symptoms. We didn't plan for an increase in people going to hospital because they trip and fall and hurt themselves in the wintertime, that we didn't see COVID was still around causing problems. To me, this is a health secretary who simply is not on top of his brief, and doesn't really know what's going on. And that's why we're in this position. And it's awful. It's absolutely awful.
What plan would you have put in place then to avoid the problems that we're seeing now?
So Scottish Conservatives and I have released our winter recovery plan, where we actually have tangible, credible things that we would do to ensure a change and make things better at this winter. And we published that about a month ago now. What we need to see is movement in the hospital. So we need to see patients coming out because we're seeing, 2014, the SNP said they'd eradicate delayed discharge. But actually, in the month of October, there was 1,898 bed days lost just in October to delayed discharge. So we would move people into interim care. Finally, something that the SNP said that they would look to be doing. We have a health service which is completely devolved. Your listeners need to understand that the SNP have been in government for 15 years. They have been in charge of the health service for that time. So when Nicola Sturgeon said it was under pressure before COVID, that was because she cut nursing numbers. That was because she cut bed numbers. We have 6,000 less nurses. We have double the number of consultant posts that are available than the government said they are. And the health secretary hasn't even met his own target when it comes to recruiting people this winter. Quite frankly, the SNP government and Humza Yousaf do not know what they're doing. So we have published an entire winter recovery plan, and we would like the SNP to take that up straight away.
Now, of course, these problems aren't only happening in Scotland. And in fact, in the NHS in England, there's really crippling issues affecting the health service there. So does that mean the UK Conservative government also don't know what they're doing when it comes to fixing problems in the health service?
As far as comparisons of health services are concerned, and I've said this from the start, I've written to the UK Health Authority that you can't compare the two A&E departments. It's simply not something that you can do.
Well, but the point I'm making is that these massive increase in flu cases and issues with COVID are affecting the whole of the UK and all of the UK nations as well.
Well, what I would say to that is we live in Scotland. We hold the Scottish Government to account, who have a total free rein on how they would deal with the health service. In fact, they're increasing taxes. Now, Nicola Sturgeon says this increase in tax is to pay for health service. Well, we need to stop wasting money across the Scottish Government. And if we didn't do pet projects, we'd have more money. If she didn't cut GP budgets and give that away in grandstanding in COP, GPs would have better money and better ability to do things for the patients on the ground. We need to hold the Scottish Government to account, and more importantly, the people of Scotland, quite frankly, couldn't care less about what else is going on around the country, around the world, across the universe. What they care about.
Well, these are problems affecting the whole. These are problems affecting the whole of the UK, though.
But people in Scotland, we heard Humza Yousaf on the BBC say that
are the UK government competent enough to be in charge of the health service in England?
Well, look, we heard from Humza Yousaf.
I'm asking you if the UK government are competent enough to be in charge of the health service in England.
The UK government is working in England, and they are they are competent, but I do not know details of the English Health Service because, one, I don't work in the English Health
But the
Service.
NHS in England is the NHS in England is facing the same problems which are crippling the health service as they are in Scotland. And you've come on this programme and said that Nicola Sturgeon and Hamza Yousaf are incompetent and not up to running the health service. So do you think that the same thing is true for the UK Conservative government?
What I would say to that is I don't work in NHS England. I don't know the figures and the numbers that are going on, and I couldn't.
I'm sure you do. I'm sure you know a bit of what's going on because it's all been reported in the news.
Well, I'm an NHS GP in Scotland. I'm the shadow Cabinet Secretary for Health in Scotland, and I look at Scotland because that is what matters to the people who elected me. That's what matters to your listeners. They couldn't care less what's going on around the world. What they care about is if they have an accident, will they be looked after? What they care about is if they get cancer, will they get treatment? What they care about, and what I have seen in my surgery today, just this morning, is somebody who is suffering in pain, wanting to have surgery. And they can't because of what is going on in the Scottish Health Service. They're not going to Wales or England or Northern Ireland or France to get their treatment. They are being treated here in Scotland. And that's what we should be focusing on. We hear a lot about England from everywhere, but actually we are Scottish. And we should be concentrating on the Scottish NHS.
Okay, thank you very much.
The point of what's going on.
Thank you for joining us. Sandesh Gulhane there, the Scottish Conservative Health spokesman.